Hello, everyone. Welcome, welcome. We are going to get started in maybe just another minute or so. So feel free to make yourself comfortable. Grab a drink. You're in for a great presentation today. So let's give ourselves like a couple more minutes to see who else joins, and then we'll just start shortly here. And for those of us who are here already, if you want to just say hi in the chat, drop your name, um, where you're based. All right, we have a few more people coming in. All right, so it is 3 o'clock on the dot East Coast time. So I'm just going to go ahead and kind of get us started here. And then I'll just let people in as they join. For those of you who do not know me, my name is Cha-Cha Miller, and I am a registered dietitian specializing in maternal and pediatric care. I am also the Chief Clinical Officer for Mother of Fact. And Mother of Fact is a telehealth platform for nutrition care from registered dietitians for women from pre-pregnancy fertility issues throughout pregnancy and even beyond. We specialize in high-risk nutrition intervention and care and work primarily with birthing people from resource-restricted areas. So if you have questions or curiosities about Mother of Fact, who we are, kind of what we do, I will drop my email address into the chat, so you can feel free to message me following the webinar. Now, before we kind of get started, I just wanted to do a little bit of housekeeping. Please keep your microphone on mute and save questions for the end of the presentation. You are also welcome to drop your questions in the chat, and we will make sure to get to as many of those as we can at the end of the presentation. So all of that said, welcome to our second webinar. This webinar is number 2 in a free webinar series that we recently launched. So please stay tuned for announcements regarding our next webinars, which will cover topics like gestational diabetes prevention and management and what to eat in the 3rd trimester to support birth and postpartum recovery. We do also have the free recording available for session number 1, which covered managing nausea and food aversions in the 1st trimester. So if you are interested, let me know, and I will send that link right over to you. So our topic for today is how to eat for energy and prevent fatigue during pregnancy. Before we jump in, though, I do want to introduce our presenter and one of the dietitians on our team, Shannon, who was previously Clorin until a couple weeks ago. She recently got married, so drop her some congrats in the chat. So she is now Shannon Crowley. So Shannon currently lives in Southern Maine with her now husband after recently moving from Boston, Massachusetts last year. She started her nutrition journey working within the clinical nutrition field in a Boston hospital and worked with a variety of patients and assisted them with medical nutrition therapy. She then transitioned to working in the outpatient diabetes clinic at the hospital and worked very closely with clients that had been diagnosed with gestational diabetes within their pregnancy. This led Shannon to want to work more within the maternal health field, and she found her way to Mother of Fact about 1 year ago. Shannon has loved working with clients throughout their pregnancy, assisting with their journey, and being part of their support system in general. Now, I will say Shannon is absolutely wonderful, and I have the pleasure of working with her every day. So now I will turn it over to you, Shannon.
Aw, thanks, Josh. Such a warm welcome. I'm super excited to be here. Thanks for having me. I love Mother of Fact and working with all of the pregnant patients. It's been so wonderful and being part of their support team. So, today we're going to talk a little bit about how to eat for energy and to prevent fatigue during pregnancy. This is definitely something that I talk about all the time with my pregnant patients. So, a good thing to kind of review and just talk about, the ins and outs. So, today we're going to discuss understanding pregnancy fatigue, the science behind why the exhaustion happens and why it peaks during each trimester, the fatigue fighting trio, so looking at iron, protein, complex carbs, and seeing how these essential nutrients work together to sustain your energy and levels naturally. Looking at blood sugar and energy management, seeing how strategic eating patterns, can avoid energy crashes and maintain stable fuel throughout the day, and focusing on strategic energy snacking for energy. So, the different combinations and timing strategies that will beat that afternoon fatigue. And then we'll wrap up with talking about looking at fatigue and how different signals may be signaling something more. So, warning signs to look out for and looking how to look to seek further medical attention if needed. So, first off, we're going to look at understanding pregnancy fatigue. So, kind of the ins and outs, the science behind it, and what is going on in the body. So, starting off, it definitely is super common that different pregnant patients feel and occurs in their body. So, it affects the vast majority of expecting mothers. This tiredness isn't just being tired, it's your body working overtime to support this new life. So, this exhaustion stems from a perfect storm of physiological changes happening in your body. So, starting off, you're definitely going to have this occur due to that increased blood volume. So, your blood volume increases 40 to 50% due to support your growing baby. So, that's a big difference. So, it definitely makes sense that your body's working overtime and feeling some fatigue from that. Secondly, your hormones are shifting. So, there's a big surge in that first trimester, especially. So, that steep increase in progesterone acts as a natural sedative, which can cause fatigue. Also, your blood will have some changes where different factors contributing can cause decreased blood sugar and blood pressure that can also impact your energy levels. And lastly, emotional stress. A lot is going on in your life after finding out that you are pregnant and carrying a new life in your body. So, mental and emotional adjustments to pregnancy definitely create additional fatigue. So, looking at trimester by trimester, so starting off in the first trimester, this is where the peak exhaustion occurs. So, symptoms typically begin here due to that rapid physical and emotional change as your body is growing this baby. So, hormonal shifts are most dramatic during this first phase of pregnancy. And as you continue on to second trimester, this is where your energy can recover a little bit. So, the levels might return and get closer back to your norm. And then it definitely is common to have some fatigue, but it might be a little bit less as it was in the first trimester. And your body is definitely adjusting to these hormones. And as we continue on to the third trimester, you might find that the fatigue can return a little bit. So it is definitely normal. Your body is adapting and changing so much. Baby is weighing more and might cause some physical discomforts. Typically, I see, further urination and maybe some sleep difficulties that can impact your rest quality. So definitely important to see, when that fatigue crosses the line. So it is normal, but we want to make sure that we're looking out for any extra symptoms that might be causing the need for looking for further medical attention. So never hesitate to contact your healthcare provider. Let them know how you're feeling, extra symptoms that you're feeling, because early intervention can really prevent serious complications. So different things maybe that you're experiencing are exhaustion that won't go away. So if it's not improving with trying to sleep and get enough rest and taking care of your body, that's something to kind of keep an eye on. Looking at some cardiovascular symptoms like dizziness, fainting, irregular heartbeat patterns. Maybe you're having chronic headaches, brain fog, or really hard time concentrating. And even maybe you might be noticing some trouble breathing or shortness of breath with normal activities that you didn't typically have shortness of breath before. So, again, if anything you realize is going on in your body and you find that you're noticing these symptoms, definitely contact your healthcare provider and let them know. So, looking at different things that we can do to help. So, we have iron, protein, and complex carbohydrates as the fatigue fighting trio. So, some different top things that recommend to help fight this fatigue. Starting off with iron, so this is your oxygen transport system. So this is very essential and critical during pregnancy, given your blood volume increases. So the recommended daily allowance jumps to 27 milligrams per day, which is nearly double the non-pregnant requirement. So iron forms the core component of red blood cells that carry life-giving oxygen throughout the body for cellular energy production. Without enough iron, both you and your baby could be at risk for complications. So, iron can be found in food sources. So, we definitely want to try to increase what we're eating. So, starting with heme iron, which is found in animal sources, you might find those in lean meats, seafood, poultry. These are all more easily absorbed by your body. Also, they're found in plant sources, which is called non heme iron. So, looking at dark leafy greens, lentils, beans, nuts, and seeds. And we want to make sure that we're pairing these foods with vitamin C rich foods to make sure that we're absorbing the iron properly and easily. So, different vitamin C rich foods could be citrus fruits, tomatoes, bell peppers, strawberries. Um, and bell peppers. So making sure that you're eating these throughout the day. It doesn't have to be within the exact meal, but incorporating them throughout the day to make sure that we're covering that basis. So totally up to you. I think variety is key. Maybe if you're having some aversions to any kind of animal based sources, maybe trying to lean on some of these non heme iron plant sources of iron to make sure you're getting some in there, and then making sure that you're taking your prenatal daily. So that should be a recommendation coming from your provider to make sure that there's iron in your prenatal. So definitely check the fact sheet on the back of your prenatal, because sometimes the gummy prenatals do not contain any iron. So want to make sure you're getting that in that sense as well. And one more thing to think about too is looking at things that can inhibit your absorption or kind of prevent that absorption of iron, which can be coffee, tea, or calcium supplements. So oftentimes we'll just recommend, taking those supplements or drinking the coffee or tea separate from your iron-rich food. So maybe you're not having your prenatal with a iron-rich meal if there's some calcium to it. And one more thing that I do typically recommend is if, maybe you're having a hard time tolerating some foods and maybe you're, not quite liking different iron rich foods, there's something you can also do, which is, how you're cooking your food. So maybe using a cast iron pan can be a great way to make sure that your food is getting some iron in it. So another little tip. Next up, we're going to look at protein. So, looking at sustained growth and energy maintenance. So, protein serves as the building blocks for your baby's development while also helping you maintain stable energy throughout the day. So, it's really going to be helpful to get against those energy crashes. So, protein fights fatigue by slowing down that digestion and stabilizing your blood sugar when you're eating protein with carbohydrates. It provides sustained amino acids for muscle maintenance and also prevents your body from using protein stores for energy. So we don't want to be using anything that's in our stores because we want to make sure we're eating enough. So incorporating protein throughout the day. So my number one rule is really making sure that your carbohydrates and protein portions sizes are equal. So if you're thinking about maybe you're eating spaghetti and meatballs, you want to make sure that you're not having one bite of your meatball and, two bowls of spaghetti. So try to make those portions a bit more equal. So different protein foods, we can look at, lean proteins from fish, chicken, and lean beef. Plant-based proteins can come from beans, lentils, and chickpeas. And then some healthy fats like nuts, seeds, and nut butters also contain some protein. So I always recommend, again, variety. Try to see, maybe more animal-based versus plant-based. Try to incorporate, different varieties, flavor them differently, just depending on how like your tolerance to different proteins are. Sometimes it can be a bit tricky with food aversions. So, definitely a great way to maximize protein intake is just trying to eat small, frequent meals and snacks throughout your day and incorporating protein at all of them. So, try not to skip protein with your meals and snacks. And you can definitely try drinkable options as well, like making fruit smoothies and getting some Greek yogurt, or adding some sunflower seeds into them if drinking your protein could be a little bit easier on you and your stomach. Lastly, we want to focus on complex carbohydrates. So, these are our smart fuel choices. So, carbohydrates are your body's preferred energy source, especially during pregnancy. We want to make sure that we're choosing the right type of carbohydrates to make sure that we're getting enough energy and not having any crazy blood sugar swings. There's two kinds of carbohydrates. The first one is simple carbohydrates. These are broken down really quickly in your body into your bloodstream and cause a quick energy spike, but then also followed by a crash. So, some examples of these simple carbohydrates are white bread, candy, and fruit juice. Complex carbohydrates are more steady and sustain energy release. They're rich in fiber, nutrients for stability. Some examples that we can focus on for complex carbohydrates are your whole grains, so brown rice, quinoa, oats, whole wheat products such as like whole grain bread, cereals, crackers, tortillas, your legumes, so black beans, chickpeas, and lentils, and starchy vegetables like sweet potatoes, corn, and winter squash. A little tip I like to give too for when you're having your starchy vegetables is keep the skin on, like your sweet potatoes, to give a little extra fiber boost. But make sure you wash your sweet potato extra well because they are grown in the ground, so you don't want to have any extra dirt. So, looking at some different ways to swap, maybe to make sure we're incorporating some more complex carbohydrates instead of simple carbohydrates, is choosing a whole fruit like an orange versus a glass of fruit juice like orange juice, choosing whole wheat pasta instead of white pasta, choosing brown rice instead of white rice, and opting for steel cut oats instead of instant oats. And something that I do recommend is, start small and see what works for you. So maybe look at your breakfast, maybe try whole wheat toast, maybe try some oats and see what you like best. Don't try to change everything all at once and then try to find at least maybe one complex carbohydrate that you like in a way that you like to eat it with a certain meal, and that's going to be a huge win. And that way you'll continue to kind of use that in your rotation of your meals and then kind of maybe then just focus on the next meal. Maybe you want to look at, if you're having a stir fry, maybe you can try to do half brown rice and half white rice and see if you like the difference of, the texture change and the taste, and then maybe work your way up to doing 100% of that brown rice in the stir fry. So definitely don't try to change everything all at once. Maybe try a couple things, see what you like, what, works in the recipes that you love, and then, incorporate some complex carbohydrates. So then moving on to looking at blood sugar and energy management. So definitely something that I talk about with all of my patients is making sure that we're managing our blood sugar to make sure we're not having any big increases or decreases drastically. So, just to review, looking at the blood sugar roller coaster that happens during pregnancy. So, it's definitely helpful to understand why maintaining consistent energy levels is important and avoiding that high and that low of the blood sugar. So, starting off, we need extra carbohydrates during pregnancy. So, the recommended daily allowance is about 175 grams of carbohydrates per day, just because both mother and baby use glucose as the primary fuel source. So, I definitely recommend working with a dietitian provider to look to see, how many carbohydrates you're eating in your day. Is it meeting, this 175 grams, or do we need to make any adjustments, just to make sure that you're, fueling yourself and baby as much as, we possibly can. Then looking at first trimester, so your insulin sensitivity increases, putting you at a risk for dangerous low blood sugar levels that can cause severe fatigue. And then noting also in later pregnancy that, in second and third trimester, your pregnancy hormones increase insulin resistance, making blood sugar management more complex. So, definitely the key insight is that these blood sugar spikes and crashes directly correlate to energy highs and crushing fatigue. So, stable blood sugar equals stable energy. So, that's why you'll definitely notice the importance of trying to make sure that we're balancing our blood sugars. That way, we're not having these crazy shifts. So, some different tips that will be helpful is looking for eating patterns for stable energy. So, trying to have strategic meal timing and composition can really transform your energy levels from unpredictable to remarkably steady throughout the day. So, off the bat, the first thing that I always recommend is trying to have frequent small meals. So, try to get something in your stomach every 1 to 2 hours to make sure you get steady fuel throughout the day and prevent nausea. So, a little analogy is think of your stomach as a small campfire and needs regular small logs in it versus large, logs that will overwhelm the fire. So I always say be prepared, always have something on you. Find things that are kind of simple and quick you can kind of snack on. It doesn't have to be a big meal, but just try to get something in your belly every couple of hours and not have large gaps of time between meals. And then, along with that, when you're eating every couple hours, always have that smart pairing strategy in mind. So, combine those carbohydrates with protein or healthy fats to slow your blood sugar absorption to make sure we're having balanced blood sugars. So, some examples could be avocado toast, apple with almond butter, Greek yogurt with berries, cheese and crackers, really whatever sounds good to you and is easy, but has those different food groups as part of it. Next, the power trio balance. So, what we talked about is trying to include iron, protein, and complex carbohydrates at every meal. This combination provides you energy, sustained fuel, and the oxygen transport just to make sure we're having optimal cellular function to reduce the fatigue. And lastly, we really want to make sure we're including fiber rich choices. So choose those fiber rich complex carbohydrates that slow digestion and prevent those blood sugar spikes. Your energy will definitely thank you for this ability you're providing it. So, some different examples and ways that we can put this into, day to day. So, how can we snack strategically to make sure that we're getting enough energy throughout the day? So, first off the bat, I want to make sure that we're beating the afternoon crash. So, I know I've talked with lots of patients that feel that they, feel good in the morning and then it hits, 2, 3 o'clock and they feel like their energy is just drained. So, we definitely have some energy rich ideas to make sure that we're helping beat that fatigue. So, the evidence based strategies can help your energy steady from morning to evening. So, we always recommend not to skip breakfast or any meal. So, after you've been sleeping throughout the night, you've had 8 hours, your body's been fasted, at least maybe more. So, we definitely want to make sure that we're breaking that fast and getting some protein with complex carbohydrates to kind of get your metabolism going, get those hunger cues going to make sure that you're getting something in your belly. And I also do find that this can be helpful for, limiting some nausea, getting something in your belly, soon after you wake up to kind of help set the tone for the day. Secondly, we want to make sure that we're prioritizing hydration because even mild dehydration slows your metabolism and energy production. So, a good indicator for being hydrated is looking at your urine and seeing if it's clear and pale yellow. So, different hydrating beverages could be water, seltzer water, unsweetened tea, beverages, broth, and also different fruits and vegetables can be, higher in water content like celery and watermelon. So, different things to kind of keep in mind. Another thing we want to focus on is nutrient dense snacking. So, snacks can also become little mini meals. That way, you're contributing meaningfully to your overall nutrition rather than just having empty calories as snacks. Then lastly, we want to make sure that we're limiting added sugars. So if you look at the nutrition fact label on the back of any product, foods that have more than 20% of daily value of added sugars create that steep energy fluctuation that will leave you more tired than before. So I always recommend, just check to see maybe different products that you use in your home, maybe the yogurt that you buy, maybe any sweetened beverages, and maybe any sauces, condiments, salad dressings. Just look to see if any has a lot of extra added sugar and maybe make some different swaps or try to look at the portion size to see if we can limit the extra added sugars in your diet. So, some examples of, some great snack combination ideas. That way they have a nice balance of immediate and sustained energy while also supporting your growing baby's nutritional needs. So, the classic energy combinations that, I always recommend is apples with peanut butter. And you can also substitute this for like a sunflower butter, almond butter if you have any preferences or allergies. Utilizing Greek yogurt with berries. You could do frozen berries or fresh, and then almonds and dark chocolate is also a great combination as well. Some more savory options could be pretzels and hummus, cheese on whole grain crackers, or beef jerky with some dried fruit. And then maybe if some liquid or like drinkable options could be a better option for you. So you could do a fruit and Greek yogurt smoothie, protein powder with milk to make a protein shake, or a green smoothie with spinach, and maybe you could add some seeds like chia seeds or flax seeds in as well. They also do sell drinkable protein shakes, just a glass of milk, or even like drinkable yogurts could be also an option too if you're more like on the grab and go option versus making it yourself at home. And if you're up for a little bit of a mini meal that's nice and hearty, getting a little bit extra in there, you could trial some scrambled eggs with a slice of toast. You could do bean and rice burrito or quesadilla, or trail mix with some nuts and seeds. So different options, really try to rotate, have a variety. Don't, only snack on the same thing every day and get bored of it. Try to make sure you have some variety in there. And always be prepared. So I always recommend, throw snacks like in your car, in your bag, at your desk at work or wherever you're going to be. So that way you're never without food. Maybe some like shelf stable ones, more like the trail mix, the beef jerky, granola bars. So different options. That way you're never without. And if you're up for it, maybe for doing some weekend meal prep or you're getting together, your grocery shopping, maybe make sure you grab some grab and go things, maybe some cheese sticks or some cottage cheese, Greek yogurt, just things to throw like in the fridge that you can kind of prep, and have on hand. If not, making some other kind of items grab and go, like different burritos or, making sure you're having your pretzels and hummus ready for you. So just being prepared and kind of having things on hand can be the best. So, one thing to kind of also focus on is pregnancy definitely comes with cravings, and these are completely normal, and all foods do fit in a nourishing diet. So, just the one thing that we focus on is how to make sure that we're pairing all these foods together to maximize our energy benefits while also honoring what your body wants and is craving. So, sweet treats I definitely do talk about a lot. And, say you're interested in some ice cream or some cookies, always just try to pair them with some protein rich nuts or a Greek yogurt just to slow that sugar absorption and extend that satisfaction so you're, satisfied after. So keeping a bag of nuts on hand can be great just to kind of have a handful when you're having those treats. Also, I'll recommend maybe if you're having a scoop of ice cream, make it into like a little sundae. You can drizzle some peanut butter on top or melt it, make it, warm drizzle, add some walnuts. So, other ways to kind of make it fun. You're still eating the foods that you love. Then maybe if you're going out for fast food, maybe you're on the go, you're traveling, or you just that's what you're craving. Maybe look to see if you can choose like a protein-rich option. So getting some grilled chicken, in whatever you're having. Maybe you could add some extra vegetables on the side or on toppings if it's a sandwich, just to get some extra fiber in there, just to make sure we're helping out our blood sugars. I always like to kind of recommend, the addition versus subtraction. So, what can we add to our meal, to our plate to help make it more balanced versus like, oh, I can't have that, I shouldn't have that. It's like, no, enjoy what you're interested in, but, what can we add to it to make it a better balanced meal or snack? High fatty foods can definitely be, a craving that I see a lot. So, they're definitely beneficial for a baby's brain development and definitely needs those good nutrient dense fats. So, if you're having any fried or higher fat foods, maybe try to pair them with some fruits or some vegetables just to add some fiber to that meal to give you some extra energy and keep you satisfied. And lastly, I definitely talk a lot about refined carbohydrates sometimes during pregnancy, nausea for any kind of, just not for a big meal. People tend to kind of lean towards plain toast or some crackers. So again, just try to pair that with some protein. So maybe if you can, have a cheese stick on the side, some hummus, some avocado, maybe a hard-boiled egg on the side. If you're craving just plain pasta or mac and cheese, maybe you can mix in some, cottage cheese or Greek yogurt to the cheese sauce to kind of bump up some protein to it. So definitely options for you to kind of add to what you're having, but not going overboard with having a whole big meal, but also trying to incorporate those, refined carbohydrates if they feel best for you in that moment. So, looking at, if we're working with our fatigue, if you're noticing that, making some changes, maybe you're trying to adjust how you're eating and you still feel like there's something going on, you're feeling like there's something, else occurring that you just can't put your finger on, definitely something to note. So we want to look at some different things also that can be going on into the body that we should be, aware about. So anemia in pregnancy is very common. So it affects up to 20% of pregnant women and occurs when your body lacks enough healthy red blood cells to carry adequate oxygen to the body's tissues. It's easily treatable, but it can be potentially dangerous if ignored. So this condition can result from not having enough iron, vitamin B12, or folic acid intake, but pregnancy itself just increases the anemia risk overall, just due to the drastically increased blood volume needs. So, different warning signs to look out for anemia could be shortness of breath during normal activities, feeling unusually cold, dizzy, or being weak, a rapid or irregular heartbeat, chest discomfort, or a sore tongue, headaches that won't go away, and pale skin. So, definitely keep an eye out for different symptoms. Your doctor, there are routine blood work screenings for anemia, but if you do feel like there's anything else going on in between these screenings, bring it up with your doctor because untreated anemia can definitely cause serious pregnancy complications, including preterm birth and low birth weight. So always reach out to your healthcare provider for treatment if you suspect there's anemia going on. Other conditions to consider. So definitely pregnancy fatigue is normal. There's different treatable medical conditions that can be masked by simple tiredness. So definitely trying to recognize and, talk about what symptoms you're having so that way doctors can provide treatment or before any further complications occur. So hypothyroidism is also something that could be occurring. So keep an eye out for symptoms like heat sensitivity, muscle weakness, mood changes, frequent bowel movements, trouble sleeping, unexplained weight changes, gestational diabetes, is something that can occur during pregnancy. So keep an eye out for excessive thirst, frequent urination, blurred vision, unusual hunger, if outside of, that you're eating enough throughout your day. And also keeping an eye out for prenatal depression. So if you're having extreme sadness lasting for more than 2 weeks, anxiety, sleep disturbances, significant appetite, weight changes, or loss of interest in activities. So, fatigue, definitely a primary symptom in each of these conditions that I just listed, but these are all highly treatable with proper medical care. So, really never hesitate to contact your healthcare provider with concerns. Early intervention is the best way to protect you and your baby. So, wrapping up, here are our key takeaways from our webinar today. So, in general, fatigue is normal. Pregnancy exhaustion is normal and expected. Your body is going through so much and creating this new life. So, be patient, be compassionate with yourself during this time. Um, and then also noticing that nutrition, it can really help you. So, using the combination of iron, protein, complex carbohydrates really helps fight that fatigue and provide you with energy. Try to focus on small strategic changes that can yield really big improvements in how you feel. And lastly, trust your instincts. While fatigue is expected, definitely you know your body best. So always communicate openly with your provider. Let them know if you find any other symptoms that you're experiencing, and really the early intervention can protect both you of your health and your baby's health. And remember, you're not just eating for fuel. You're fueling this amazing journey of pregnancy with every nutritious choice that you make. And here are our references if anyone is interested in taking a peek at anything that I talked about today, learning more. And that concludes the webinar. So please, if anyone has any questions, please enter them in the chat and I'm happy to answer them.
Thank you so much, Shannon. That was awesome. Very, very informative. I know I learned a thing or two. If there are any questions, please feel free to drop them in the chat, or if you're comfortable, feel free to come off mute. But in the meantime, I have a question for you, Shannon. So let's say I am too tired to cook. What are some simple, balanced dinner shortcuts that I could use to prepare a meal for my family if it's not just me?
Sure, yeah, great question. I talk about this all the time. Like people want nice, quick, options that way they're feeling like they're fueling themselves, their families, but not having to spend hours in the kitchen. Um, So definitely there's so many options. I think number one, I always recommend like using your freezer. Maybe it's an easier shortcut for you to have some frozen vegetables that you can easily microwave or throw into a dish, and there's no chopping, there's no cleaning, everything's just kind of ready to throw into a dish. Same with, microwavable rice that could be found in the freezer. Instant rice could be an option. And then maybe you have some frozen chicken breasts. So you can make a little stir fry that's, three things from your freezer, throw into a dish. Um, I think definitely if it's something, another option could be to prep some things ahead of time. So maybe if you know that you're going to eat some potatoes throughout the week, or you bought a big bag of potatoes, just cook them all. They'll last for 3 to 5 days in your fridge, and you can use them with your breakfast with eggs. You can throw them with some, I don't know, like a burger bowl for dinner, or throw them with whatever kind of like dish that you might want. So kind of big batches. Same with like vegetables too. I've seen people will either do like a raw veggie platter and kind of just kind of prep them all at once if they have like an hour spare time and just munch them throughout the week, or just roast a bunch of vegetables and then throw them into all various dishes. um
I
yeah,
love
so a couple different options there.
I love that. Thank you so much, Shannon. Now, I am going to ask you a question that I get often from a lot of my patients. Now, is caffeine safe for energy during pregnancy? And if so, how much is okay? Like, can I continue going to Dunkin' Donuts and getting my extra large coffee in the morning, or would I have to stop?
Yeah, great question. I do hear this a lot all the time. So the recommendation is trying not to exceed 200 milligrams of caffeine a day. So caffeine can be in all different forms. Like there's, comes from coffee, there's energy drinks, there's tea. So just keep in mind, maybe if you're having different beverages throughout the day, like to add them up just to maybe how much you're having. But we want to make sure that we're staying below that 200. So your typical, large cup of coffee should be okay, but be careful because, if you're getting double espresso shots and, there could be some stronger coffees out there that might not seem it, but there's more caffeine to them. So I do know that different, Starbucks and Dunkin' Donuts do have different guides on their websites too that will document how much caffeine is in each of their drinks. So if you're someone that loves your, small iced mocha, maybe you can see how much caffeine is in there. Maybe, it's within the limit and you're able to have it.
I love that. Okay, we have a question in the chat from Destiny. She says, is all of this applicable for someone with gestational diabetes too, or is there anything that you would add for that?
Yeah, good question. So definitely, as someone has gestational diabetes, we do want to focus on blood sugar management, consistent eating throughout the day, looking at what choices that you're making with your food. But again, I would definitely recommend that person to be working with a dietitian that, is trained, because it is very specific depending on what's going on in their body and what their blood sugar readings are, because we do want to focus on the carbohydrates, how many they're having, and how that is affecting their blood sugar. So hard to say a blanket statement, but definitely I would say that most things do apply for someone that has gestational diabetes.
Yeah, definitely. Are there any other questions? Because if not, I can totally keep going. I don't see any more in the chat, so I'm gonna ask you one last question, Shannon. Now, how do I balance eating for energy with also managing weight gain during pregnancy? If that is something that is concerning for me, how, like, tell me how I strike a good balance.
Yeah, good question. I do feel like, body weight, different body image during pregnancy can be, something that's a bigger topic that, can be good, one on one basis. But in general, I do think that we want to make sure that we're nourishing ourselves. We want to make sure that we're not having any weight loss during pregnancy. So I do think that if there is some weight gain or definitely weight maintenance, could be something that was more ideal. But I do want to make sure that we're nourishing ourselves and our body and listening to our hunger cues. So something to keep in mind is maybe just looking to see, okay, what am I eating throughout the day? Am I having protein with my meals and my snacks to keep me nice and full? Maybe is there a factor with exercise? Are you exercising, going on walks? Maybe you're doing an extra movement, running around with, if you have kids as well, maybe that can be causing some extra hunger there, which is totally normal because you're using more energy. So there's definitely many factors, but I do feel like just looking at your energy levels versus weight, I do think that it kind of depends on the person, but definitely weight fluctuations are normal, and you should be, working with a dietitian to kind of see while you're eating and where you can be adding some things in to make sure you're satisfying yourself and not having just empty calories that could be adding extra calories to your day.
Perfect. Okay, so I have two more questions. Destiny asks, how do we know if a meal has enough protein?
Yeah, great question. I do feel like protein's a hot topic, and I do see it all over social media. So our go-to is recommending, looking at, like, your plate. You want to make sure that your protein is going to be the size of a quarter of your plate. So that could be, if you're having a piece of meat, that could be like a deck of cards. That could look like the palm of your hand. So a couple different examples of what that might look like. Not all meals just has, a chicken breast on it. It could be more of like a stir fry or something. But depends on the person. It's hard to kind of say what exact amount of grams of protein should be per meal. Depends on the person, what their needs are. Maybe it's 20 to 30 grams, could be a little bit more, a little bit less. But I would say trying to make sure that it matches the size of your carbohydrates. So trying to make sure that you're having enough and focusing on eating that protein first if your appetite's on the lower side. I wouldn't want you to have one bite of your chicken breast and then, not finish your meal. So I want to make sure that we're focusing on the protein first if the appetite could be an issue.
Yeah, I love that, Shannon. And I also, what I recommend to a lot of my patients, sometimes they get stuck on the number and like hitting a specific target. So I just recommend that they try to have a protein source at every meal and snack. So that way they don't have to, track, use a MyFitnessPal or whatever it is. They can just kind of keep it in the back of their mind as a checklist. So they can say, okay, do I have my carbohydrate? Yes. Do I have my source of iron? Yes. Do I have my protein? Yes. Okay. This is a, well-balanced meal. So, yeah, so that's kind of how I approach it sometimes. I do have another question from Keturah. I hope I said your name correctly. She says, in my practice, we have patients who live in shelters and do not always have access to a kitchen to prepare meals. You mentioned microwavable foods. Is this okay for the entire pregnancy?
I guess my other question is, it depends on your situation, I would say. If there's access to a microwave, that is definitely okay. But I do think that shelf stable things are totally fine. Like, you could also get cans of tuna, cans of chicken that, as long as you have a can opener to open them, using different like canned vegetables and whatnot. But I would say using a microwave and utilizing these foods are definitely fine. Like, you're nourishing your body and you're able to be eating consistently and not going without food. So I would say it's definitely fine throughout your pregnancy.
Yeah, I definitely agree. I used to work as a WIC clinic manager, so I worked with a lot of patients who didn't necessarily have stable housing or things like that, and those convenience foods still provide a ton of nourishment, and as long as they are accessible, as long as the patient is able to get to them, then I say go for it, especially during pregnancy because it is such a time of heightened nutritional need. I always tell my patients I would rather have you eat something than nothing. So in a lot of these situations, and I know most people don't expect a dietitian to say that, however, your energy needs are like substantially increased during pregnancy. So it's like every little bite counts. So I definitely encourage those convenience foods, microwavable foods, packaged foods, canned foods, like you mentioned, Shannon. I think they are all valuable and they all serve a purpose, and they can be, you can depend upon them throughout the entire pregnancy. So I hope that answers your question. Now I don't see any other questions in the chat. I did drop my email in the chat, so if you have questions, you can feel free to reach out to me directly. But other than that, thank you guys so much for joining us today, and I hope to see you guys at the next webinar.